stop. If your blood sugar is climbing despite perfect compliance, what I'm about to tell you will either make you furious or finally set you free. For 24 years as a surgeon, I've watched patients follow every rule, take every medication, restrict every food, and still watch their numbers spiral. And here's what nobody is telling you. You're not failing, your doctors aren't lying, but you're all fighting the wrong enemy. Right now, at this exact moment, there's a 90% chance your cells are rejecting insulin, not because of what you ate, but because of something so basic, so obvious that it's been hiding in plain sight for decades. The medical system won't prioritize this because there's no drug for it, no procedure, no billable code. But I have seen it drop fasting glucose by 50 points in 2 weeks without changing a single meal. I'm Biblio Diet, 24 years of surgical and clinical experience. And what I'm about to show you isn't experimental. It's not controversial. It's physiology that's been deliberately ignored because it doesn't generate profit. This is the variable that determines whether insulin can do its job before food or medication ever enter the equation. And if you've been told your only option is more restriction or higher doses, that ends today. Here's what's happening. The problem is often not what you're eating. It's how hydrated your cells are. Blood sugar doesn't rise only because glucose enters the bloodstream. It rises when glucose can't get into cells, and one of the fastest ways insulin stops working properly is cellular dehydration. Same meals, same medications, very different biological response depending on hydration status. That distinction changes everything. This is not about replacing your treatment. It's about restoring the internal environment your treatment depends on. By the end of this video, you'll understand why fasting glucose becomes unpredictable with age, how hydration timing affects insulin sensitivity more than hydration volume, why cold water can actually worsen morning readings, and how a simple hydration structure can stabilize blood sugar without adding a single restriction to your life. This is realistic. This is physiology-based, and you can start today. Now, before we go further, if this kind of calm, science-based guidance matters to you, consider subscribing. I read every comment, and if this resonates as we go, just type approved and I'll know this helped. Let's get into what's really happening and why hydration matters more after 60 than almost anyone explains. Most adults over 65 are chronically dehydrated, even if they don't feel thirsty. That's not an exaggeration. It's measurable. And dehydration makes blood sugar control unnecessarily difficult, regardless of diet or medication. Yet, hydration timing is rarely discussed in diabetes care. It's treated as optional as general wellness advice, but it's not optional, it's foundational. As we age, 4 things change that make hydration harder. First, cellular water channels called aquaporins become less responsive. These are the gatekeepers that let water into cells. When they slow down, cells can't hydrate efficiently even when you drink. Second, kidney filtration efficiency declines. Your kidneys can't conserve water the way they used to. Third, thirst signals weaken and delay. By the time you feel thirsty, you're already significantly dehydrated. And fourth, common blood pressure and diabetes medications pull water from the body as part of their mechanism. You can be profoundly dehydrated without knowing it. No dry mouth, no obvious signs, just rising blood sugar that no one connects to hydration. Here's why that matters so much. Even mild dehydration makes cell membranes more rigid. Rigid cells resist insulin. Glucose stays in the bloodstream not because you ate wrong, but because your cells physically can't accept it. Insulin is like a key, but if the lock is stiff, the key doesn't work. That's why your numbers rise despite doing everything right. The food isn't the problem. The medication isn't failing. The environment inside your body is changed. And once you understand that, everything else starts to make sense. Let me give you an example. Mark, 72. Mark's fasting glucose had been stable for years, consistently in the 120s. Then suddenly it climbed into the 180s. No diet changes, no missed medication, no explanation from his doctor beyond age and disease progression. When we looked closely, he was drinking fewer than 2 glasses of plain water per day. Everything else was coffee, which is a diuretic, or juice, which spikes blood sugar. We adjusted hydration timing and temperature only. Didn't change his food, didn't adjust his medication. Within 2 weeks, his morning readings dropped into the low 30s and stayed there. Same food, same meds, different hydration strategy. That's the power of addressing the right variable. Now, here's the core insight I want you to hold on to. Blood sugar instability is often a volume problem, not a food problem. When cells are hydrated, insulin works. When they're not, nothing else matters. You can eat perfectly, you can take your medication exactly as prescribed, but if your cells are dehydrated, glucose has nowhere to go. It's like trying to pour water into a bottle with the cap still on. The water isn't the problem. The bottle is sealed. And yet, most treatment plans focus exclusively on what you're pouring, never addressing whether the bottle can actually open. Let me show you the 3 most common hydration mistakes people make after 60. Mistakes that quietly worsen glucose control every single day. First, counting coffee, tea, or juice as water. These fluids have effects on the body. Coffee is a diuretic. It pulls water out. Juice spikes blood sugar. Tea can be fine, but it's not the same as plain water for cellular hydration. Your cells need water, not flavored liquid. Second, drinking ice-cold water, especially in the morning. Cold water causes vasoconstriction. Your blood vessels tighten, that reduces circulation to cells and slows glucose uptake. Room temperature or slightly warm water improves absorption significantly. And third, drinking large amounts only once thirst appears. By the time you feel thirsty, you're already dehydrated. Your cells are already resistant. You're trying to catch up instead of staying ahead. These patterns are invisible. No one told you they mattered, but they do. So, what's the solution? I call it the WTR protocol. W for water quality, T for timing, R for regulation, and adaptation. Let's break it down step by step so you can implement this starting tomorrow. First, water quality. Filtered water is ideal. Tap water works, but filtered removes contaminants that can affect absorption. More importantly, minerals matter, especially magnesium, potassium, and sodium. Why? Because glucose transport is electrical. Insulin signals cells to open. That signal is electrical. Without minerals, the signal weakens. A simple trace mineral addition, a pinch of sea salt, or a mineral drop improves cellular hydration dramatically. You don't need expensive products, just mineralized water. Now, timing. This is where most people get it wrong. It's not about how much you drink, it's about when. There are 4 hydration windows that stabilize blood sugar better than random drinking throughout the day. First, immediately upon waking, room temperature 12 to 16 ounces. This rehydrates after the overnight fast, reduces cortisol-driven glucose release, and primes cells for insulin sensitivity. Second, 30 minutes before meals, 8 to 12:00. This improves blood flow to the digestive system, slows carbohydrate absorption, and prevents post-meal spikes. Third, mid-morning and mid-afternoon, 8:00 each. This maintains circulation and prevents the gradual dehydration that causes afternoon blood sugar variability. And fourth, 2 to 3 hours after your last meal, 8:00. This supports overnight kidney function without disrupting sleep. Same water, different timing, different outcome. Here's why timing works. It improves blood flow. Hydrated blood is less viscous. It moves faster. It delivers insulin to cells more efficiently. It reduces cortisol-driven glucose release. Dehydration is a stressor. Stress hormones raise blood sugar. Hydration lowers stress response. It slows carbohydrate absorption. Water before meals dilutes stomach acid slightly and slows gastric emptying. This smooths out glucose curves, and it stabilizes fasting and post-meal readings. Consistent hydration creates consistent cellular response. Your body stops guessing. It knows what to expect. Now, I need to address something you're probably thinking. Yes, you'll urinate more at first. That's normal. That's your body recalibrating. For the first week, maybe 10 days, you'll visit the bathroom more often. That's not a problem. That's adaptation. Within 10 to 14 days, your kidneys, bladder, and cells recalibrate. Blood sugar variability decreases. Mental clarity improves. Energy stabilizes. The inconvenience is temporary. The benefit is lasting. This is the regulation phase. Your body is learning to hold on to water efficiently again. It's reactivating those aquaporin channels we talked about. It's training your kidneys to filter without wasting. Give it time. Trust the process. Let me walk you through what to expect week by week. Week 1, more bathroom trips, minor changes in readings, maybe a slight drop, maybe not. This is normal. Your body is adjusting. Week 2, less variability. Your fasting glucose starts to stabilize. Post-meal spikes become smaller. You'll notice the difference. Week 3, noticeable fasting glucose improvement. This is where most people see numbers drop into a better range. Mornings become predictable again. And week 4 and beyond, A1C improvement under medical supervision. This is when labs start reflecting what you've been feeling. Consistent hydration creates consistent results. Let me give you another example. Elaine, 75, Elaine's A1C climbed from 7.9 to 8.8 over 6 months. Her doctor was discussing insulin. She was panicking. She thought she was failing. When we assessed her hydration, she was severely dehydrated without realizing it, drinking maybe a glass of water a day. Everything else was diet soda and decaf coffee. We implemented structured hydration, minerals added 4 windows room temperature. 3 months later, her A1C dropped to 7.4. No new medications, no extreme diet, just restoring the environment her body needed to use the medication she was already taking. That's the power of getting the basics right. Now let me address some myths I hear constantly. Myth number 1, if I'm not thirsty, I don't need water. Wrong. Thirst is a late-stage dehydration signal. By the time you feel thirsty after 60, you've been dehydrated for hours. Myth number 2, drinking water with meals dilutes digestive enzymes and is bad for you. Not true. Water before meals is beneficial. Water during meals in moderate amounts is fine. Your stomach acid is strong enough to handle it. Myth number 3, you can get all your hydration from food. While fruits and vegetables contain water, it's not enough for optimal cellular function, especially as you age. You need plain water. And myth number 4, everyone needs 8 glasses a day. The amount varies by body size, activity level, medications, and climate. The 4-window structure is more important than hitting an arbitrary number. Here's something that matters. In winter, people drink less water because they don't feel hot, but indoor heating dehydrates you significantly. Your home's furnace pulls moisture from the air, which pulls moisture from your body. Winter dehydration is real and often worse than summer dehydration because it's invisible. You're not sweating, so you don't think about it, but your blood sugar knows. I see more unstable readings in January and February than any other months. Not because of holiday eating, that's November and December. It's because of winter dehydration in the months after. So in winter, you actually need to be more intentional about hydration, not less. Summer brings different challenges. You're sweating more, losing electrolytes faster. This is when minerals become even more critical. A pinch of sea salt in your water isn't just helpful, it's necessary. Without it, you can drink water all day and still be dehydrated because you don't have the electrolytes to hold the water in your cells. It just passes through. I've seen people confused about why they're drinking constantly but still feeling dehydrated and seeing high blood sugar. It's the minerals. Always the minerals. Let me tell you about George, 73. George was doing everything right, eating well, exercising, taking medication, but his morning fasting numbers were consistently in the 150s. He was frustrated. We discovered he was drinking a full liter of water right before bed because he'd heard hydration was important. But he was waking up 3 times a night to urinate. His sleep was destroyed. Poor sleep was spiking his morning cortisol, which was spiking his fasting glucose. We moved that liter to throughout the day in the 4-window structure and reduced his evening water to just 8:02 hours before bed. Within 10 days, he was sleeping through the night. Within 3 weeks, his fasting glucose dropped to the low 120s. Same total water intake, completely different timing, completely different result. Here's what nobody tells you about blood sugar testing. The consistency of your readings matters more than occasional spikes. If your fasting glucose is 130 every single morning, that's actually better than bouncing between 90 and 180. Consistency means your body knows what to expect. It can adapt. Variability means constant stress and adjustment. consistent. Structured hydration creates consistency. Your body learns the pattern. Your cells expect the water. Your insulin response becomes predictable. This is why week 3 is when most people see dramatic improvements. The body has learned the new pattern. Now let's talk about medication interactions. Some blood pressure medications are diuretics. They make you urinate more. If you're on these, you need even more intentional hydration. But here's the key: you need to space it properly. Don't drink a huge amount right after taking a diuretic. It just goes straight through. Instead, sip consistently throughout the day. Let your body absorb it gradually and talk to your doctor. Some people on diuretics need their dose adjusted when they start hydrating properly because their blood pressure improves naturally. This happened with 3 of my patients. Better hydration, better blood pressure, lower medication needed. Always done under medical supervision, but it happens. Here's a question I get often. What about coffee? I love my coffee. Can I still drink it? Yes, but understand what it does. Coffee is a diuretic. For every cup of coffee, you need an additional 8 ounces of water to compensate. So if you have 2 cups of coffee in the morning, that's 16 ounces of extra water you need beyond your regular hydration. And never count coffee toward your hydration windows. It's separate. Water is water. Coffee is coffee. They serve different purposes in your body. Let me share something personal. Early in my career, I didn't pay much attention to hydration. It seemed too basic, too simple to matter. I focused on the complex stuff, surgical techniques, medication protocols, advanced diagnostics. But over the years, I kept seeing the same pattern. Patients who hydrated well recovered faster from surgery. Their wounds healed better. Their blood pressure was more stable. Their blood sugar was easier to manage. It was undeniable, and I realized I'd been overlooking the foundation while focusing on the structure. Once I started teaching this to patients, the results spoke for themselves. I'm sharing this because I want you to know I learned this the same way you are, through observation, trial, and undeniable results. And here's something about accountability that helps. Yeah. Find someone to do this with you. A spouse, a friend, a sibling. Check in with each other. Did you do your morning water? How are your numbers? This isn't about pressure, it's about support. My most successful patients had partners who did this with them. Even if the partner didn't have diabetes, they benefited from better hydration too. Everyone wins. Now let me be very clear about something. This is not a cure. Never stop medication without your doctor. If you have heart failure, kidney disease, or take diuretics, speak with your physician first. Hydration can affect medication levels and fluid balance. You need supervision. Watch for overhydration signs, swelling in your ankles, sudden weight gain, headaches, nausea. These are rare if you follow the protocol, but they're possible. Adjust gently, listen to your body. This is about supporting your treatment, not replacing it. Here's how to track your progress properly. Get a simple notebook, not an app, not a fancy system, a notebook. Each day, write the date, your 4 hydration windows with check marks, and your blood sugar readings. Morning fasting, 2 hours after breakfast before bed. That's it. After 2 weeks, look at the pattern. You'll see the connection. You'll see how hydration days correlate with better readings. This visual proof keeps you motivated when discipline wavers. Let me tell you about the people who struggle with this. Usually, it's not because the protocol doesn't work. It's because they overcomplicate it. They buy expensive alkaline water machines. They stress about the exact mineral ratios. They try to be perfect. Don't do this. Simple works. Filtered water or clean tap water works. A pinch of sea salt works. 4 times a day works. Perfect is the enemy of progress. Start simple, stay consistent, results follow. Here's a troubleshooting guide for common issues. If you're hydrating properly but still not seeing results after 3 weeks, check these things. 1, are you actually drinking room temperature water, or is it cold? Temperature matters. 2, are you adding minerals or just drinking plain water? Minerals matter. 3, are you timing it properly or just drinking randomly throughout the day? Timing matters. 4, are you compensating for coffee and medications that dehydrate you? Compensation matters. And 5, are you getting enough sleep? Sleep affects everything. If you're doing all 5 correctly and still not seeing results, then you need to look at other variables with your doctor. Here's what happens long-term when you maintain this. Your body becomes more resilient. You can handle stress better. You can handle occasional indulgences better. You can handle schedule disruptions better because your foundation is solid. I've had patients tell me they can now have birthday cake at family gatherings without their blood sugar spiking dangerously because their baseline hydration keeps their cells responsive. That's freedom. That's what this gives you. Not perfection, but resilience. And let's talk about what this means for your family. When your kids or grandkids see you taking control, implementing something this simple, and seeing results, you're teaching them. You're showing them that health doesn't have to be complicated. That small, consistent actions matter. That bodies respond when we give them what they need. You're modeling healthy aging. And that's a gift beyond blood sugar control. That's legacy. Here's my final challenge. Don't just try this for 2 weeks. Commit to 90 days. That's how long it takes for real cellular adaptation. That's how long it takes to see A1C changes. That's how long it takes to truly know if this works for your body. 90 days of 4 hydration windows, 90 days of minerals, 90 days of room temperature water, 90 days of tracking. If after 90 days you see no improvement, then we reassess. But I've never seen someone do this correctly for 90 days without measurable improvement. Never. So let's talk about implementation. Talk about how do you actually do this? Start with 1 hydration window this week, just 1. Pick the easiest one. For most people, that's waking up. Set a glass of room temperature water on your nightstand tonight. Drink it first thing tomorrow. Do that for 3 days. Then add the before meal window, 30 minutes before lunch. Do that for 3 days. Then mid-morning, then mid-after afternoon, then evening. Build slowly. Let your body adapt. Don't try to do everything at once. This isn't a race. It's a recalibration. Here's what you need: a water filter if possible. Not required, but helpful. Trace minerals, sea salt works, mineral drops work, a pinch in each glass, a reusable water bottle. Mark it with measurements so you know how much you're drinking. And a simple tracking sheet. Just check boxes for each window each day. This keeps you honest without being overwhelming. Now let's address the questions I get most often. First, what if I forget a window? It's fine. Don't double up. Just resume at the next window. Consistency matters more than perfection. Second, can I drink more than the recommended amounts? Yes, but gradually. Don't jump from 2 glasses a day to 12. Your body can't process that. Build slowly. Third, what if I'm already drinking a lot of water? Then focus on timing and temperature. You might already have the volume. You just need the structure. Fourth, does this work if I'm on dialysis or have severe kidney disease? No, this protocol is not for you. You need medical supervision for all fluid intake. Please consult your nephrologist. And fifth, how long until I see results? Most people notice steadier energy and mental clarity within a week. Blood sugar improvements typically show up in week 2 or 3. A1C changes take 3 months because that's how the test works. It's measuring average glucose over 3 months. Be patient. Your body is healing. That takes time. Let's talk about what else changes when you hydrate properly. Your skin improves. Hydrated skin is more elastic, less fragile. Your digestion improves. Constipation, a common issue with diabetes medications, often resolves. Your sleep improves. Dehydration disrupts sleep cycles. Proper hydration stabilizes them. Your mood improves. Dehydration increases anxiety and irritability. Hydration calms the nervous system. Your blood pressure often stabilizes. Dehydration makes blood thicker, harder to pump. Hydration reduces cardiac workload and your kidney function improves. Kidneys need water to filter efficiently. Give them what they need and they perform better. These aren't side effects. These are whole body benefits of doing one thing right. Now, I want to address something deeper: the emotional weight of blood sugar instability. If you've been managing diabetes for years, you know the guilt, the frustration, the feeling that your body is betraying you. Every high reading feels like failure. Every medication increase feels like proof you're not trying hard enough. And the advice keeps getting more restrictive. Eat less, move more, be perfect. It's exhausting and it's often misguided because if the foundation isn't right, no amount of restriction will fix it. You can't discipline your way out of cellular dehydration. You can't willpower your way to better aquaporin function. You need to restore the environment first. And that's what this protocol does. It gives your body what it needs to respond to everything else you're already doing. Here's the truth most people don't hear. Your body wants to heal. It wants to regulate blood sugar. It wants insulin to work, but it can't do that in a dehydrated state. It's like asking a car to run without oil. The fuel is there, the engine is there, but the system can't function. Add the oil and everything works. That's what hydration is. It's the oil in the system. And once it's there, everything else you're doing, the diet, the medication, the exercise, all of it works better. Not because you changed those things, but because the environment changed. Your cells can finally respond. Let me share one more story. Robert, 68. Robert had been diabetic for 12 years. His fasting glucose was consistently in the 160s despite medication. He was discouraged, thought he'd need insulin soon. We implemented the WTR protocol. Within a month, his fasting glucose dropped to the 130s. Within 3 months, it was in the 1-teens. His doctor reduced his medication. Robert cried in the office. He thought he was broken. He wasn't. He was dehydrated, that's all. And once we fixed that, his body did what it was designed to do. It regulated, it healed, it responded. Now, here's what I want you to understand about long-term sustainability. This protocol is not a temporary fix. It's a permanent shift. Once your body recalibrates, you maintain it. You don't stop. Hydration becomes as automatic as brushing your teeth. You don't think about it. You just do it, and the benefits compound. Year 1, your blood sugar stabilizes. Year 2, your A1C stays in range without increasing medication. Year 3, you might reduce medication under supervision. Year 5, you're still stable, still healthy, still independent. That's the goal, not a quick fix, a sustainable foundation. And here's the thing about foundations. Once they're solid, you can build on them. You can add better nutrition, you can increase activity, you can reduce stress, but those things only work if the foundation is there. Hydration is that foundation. It's not glamorous, it's not exciting, but it's essential, and it's been overlooked for far too long. So let's talk about what to do next. If this resonated, start tonight. Put a glass of room temperature water on your nightstand. Add a pinch of sea salt. Drink it first thing tomorrow. That's step 1. Then come back and tell me what you notice. Comment approved if this helped. I read every single one. And if you want a deeper step-by-step framework for improving metabolic health and longevity, I've included my most anticipated longevity guide at a significant discount. You'll find it in the description and pinned comment. It goes beyond hydration into sleep, stress, nutrition, all the variables that matter after 60. But hydration is where you start. Now let me show you something most doctors never connect. Your medication timing and your hydration timing work together. If you take metformin in the morning but you're dehydrated, the medication can't distribute properly through your bloodstream. It's like trying to deliver packages in a traffic jam. The medication is there, but it can't reach the cells that need it. I had a patient, Linda, 67, who was taking her diabetes medication every morning with coffee. Just coffee, no water. Her doctor kept increasing the dose because her numbers weren't improving. When we added 16 ounces of water 30 minutes before her medication, then took the medication with another 8 ounces, her response to the same dose improved dramatically. Within a month, her doctor actually reduced her medication back to the original dose. The medication didn't change. Her body's ability to use it changed. Here's something else that matters. The temperature of your water throughout the day affects different bodily functions. Morning water should be room temperature to warm because your body's core temperature is lower after sleep. Cold water forces your body to work harder to warm it up, which triggers stress hormones, which raises blood sugar. It's counterproductive. But here's the interesting part. Later in the day,